Capital Care Center is located in the capital of Illinois, Springfield, and we are approximately 2 blocks from both of the hospitals which refer patients to us. We take most of our referrals from the hospital setting because we really do take some pretty acutely ill patients in the facility.
On any given time, at least 50% of our residents are in need of some form of treatment to a wound, whether it be vascular, whether it be pressure, a host of different kinds of wounds, skin tears, so forth, so on. And what we try to do is we work as a team here.
Every wound has its specific or unique properties, and the treatment for each is individualized. Our interdisciplinary team assesses wounds upon admission and along the course of the way. That team consists of the dietary department, physical therapy, occupational therapy, and speech therapy. All have their input into wound treatment, as well as the nursing department, of course, assists greatly with repositioning techniques, with wound treatment, assessment on a daily basis, and communication to the physicians and to the dietitian should there be adjustments needed to the plan of care.
This is Amy. Amy was admitted to our facility approximately 3 weeks ago following a motor vehicle accident. She sustained multiple injuries. Upon admission to our facility, we did an assessment. She was found to have multiple open wounds. It was determined that she needed one of our specialty mattresses, which is called a low air loss bed. What this bed does is it alternates Amy's pressure points while she's laying in bed to ensure that she doesn't develop any further breakdown. Another product that Amy is using in part of her wound care is what we call a wound vac. She has a large surgical wound in her abdominal area due to her injuries. This is utilized to promote the healing from her wound from the inside out. The staff is specially trained to operate and apply one of these devices. It works well in cutting infection and promotes quick healing, so they have a faster rehab.
This is my friend Margaret. She's been here for about 2 years now. And Margaret, we concentrate mostly on preventative things such as our wound program, such as our skin program, and making sure that she gets the barrier clean, she's dry, she doesn't have skin breakdown.
Wound care is so important to our residents because, number one, it is a huge source of infection that can cause a person to become very, very ill quickly. A wound, unmanaged wound, could be very painful and again can be a portal for a very serious infection.
Part of wound care management is to reposition the residents in their beds. It prevents wounds, bed sores. The procedure of wound care management is to turn and position the residents as often as possible. So we usually put pillows behind their back to prevent pressure. Anything touching that could hurt the resident in any way, we make sure that nothing's touching.
Physical therapy is important with wound care management in different aspects. We have an electrical stimulation machine that we use, and we also have sound wave diathermy, and we also use ultrasound. With this patient, what we're doing with the sound wave diathermy is we're positioning it underneath the knee. It'll increase the blood flow to that area through deep heat, and with more nutrients down there and more blood flow, that it will help the leg heal. Regardless of what modality we use, our end goal is to have a healed wound.
We have a lot of success stories here at Capital Care Center with wound treatment. The staff feels absolutely wonderful when they are able to be a part of the wound treatment and they see the progression from admission through the healing process, and they get to send that patient home. They get to go in and tell them goodbye that day, and oftentimes those patients return to the facility to visit, and it's just a great thing to help a human being recover and go back to the community.